If you're a busy woman trying to figure out what to do about healthcare next year, don't click away because in a few minutes, especially my final point, I'm going to show you how to protect your health, your time, and your wallet in the system that is becoming more expensive and more confusing. And I'm also going to share a story that explains exactly why this matters so much. So keep listening. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician here in Sugar Land and founder of InTouch Primary Care in Sugar Land, Texas. We've built a membership-based model that focuses on wellness, access, and personalized care, not worry, surprise bills, or rushed 10-minute visits. So, as we all know, healthcare costs are rising again, and many plans are actually going to double over the next few months. And they're going up by double digits. And that's frustrating because, you know, a lot of people are already paying more and they still can't get the care they need. Many people are waiting months for an appointment, and then when they finally get in, the visit feels rushed. And meanwhile, they're feeling like they're getting sicker instead of healthier. So why am I talking about this? I'm a physician, I'm not an insurance agent, but this is what I've seen over and over again. I've seen several people lost their health insurance and they didn't realize or didn't even consider that they should still or could still get health care. They assumed that because they didn't have health insurance, they had to hold off taking care of their health. Unfortunately, by the time they do come back, simple issues have become more complicated ones. So I've seen people who once had prediabetes return with A1C levels as high as 15, and then by then they have kidney damage, heart failure, problems with their eyes, so many things. Some of these things could really have been managed if they were addressed early on with lifestyle changes, maybe with just one medication. Now, these people need 4 more medications, including injections. And unfortunately, this is not rare. This happens far too often. And I believe it's because too many people assume that they can't get health care without insurance. But insurance is simply a promise to help cover costs. It doesn't prevent disease. It does not monitor your symptoms. Insurance doesn't make anybody healthier. Healthcare does. And so there's no point choosing a health plan that doesn't actually help you get healthier. And it's equally important to take care of ourselves, even if we don't have insurance. So, as we know, our health affects everything, our work, our family, our energy, our peace of mind. So it's not worth delaying care at all. So if you're frustrated though with your options, maybe you're paying high premiums and you feel like you're not getting the access you need, you're feeling rushed, you're feeling unheard, there is another approach, a better approach worth considering. And this is called direct primary care. It's a model we use here at InTouch Primary Care. What it offers the same next business day appointments. You have direct access via text, video to the doctor. You have longer, unrushed visits so that your questions are answered, so that your conditions are, you come to a solution. And it's very preventative focused. The pricing is clear, upfront, and your doctor actually knows you and knows your story. And while I speak often, to women, I see both men and women but I realize that a lot of women make this healthcare decisions for their families. So this Wednesday, if you want to learn more about this membership-based care, I'm going to be hosting a free webinar Wednesday at 6 p.m. You can join via the Zoom link in the caption. And I'm going to be discussing more about how you can protect your health in 2026, regardless of your insurance situation. So if you're trying to figure out what to do, I highly recommend that you join us for that webinar. And if you're a woman who takes care of everyone else, this is a great opportunity to take care of yourself and learn how you could support your family's health too. So the link will be in the caption. Go ahead and register. So, a lot of times when we make health decisions, we don't really think through the goal entirely. And, before you make any healthcare decisions, I would encourage you to ask yourself, like, if nothing changes about my healthcare today, where will my health be a year from now or 3 years from now? Because health is foundational for everything we're trying to do. There's no point chasing anything else if our health is not going to allow us to do these things. So if you're trying to build a career, a family, a future, we really need to focus on our health and make sure that we are getting health that truly supports our lives. So when you finish this video, I'll also encourage you to watch the last episode before you cancel or renew your health plan, what to consider. So go ahead and watch that because it connects directly to what we've discussed today, and it'll give you additional clarity. And if this was helpful, go ahead and like this video, share, subscribe, because it helps more people, more women, more families find practical ways to take control of their health. And if you'd like to have a personal conversation to learn more, you're welcome to schedule a free 15-minute consultation, and I'll be happy to talk with you. I hope that helps.